Start out.
Great.
Start out with Wes.
All right. If you guys don't mind muting, if we're gonna kick things off, or I will mute you for you. Okay, thank you. Good morning, everyone, or afternoon. See, there I go. Good afternoon. Thank you for coming to our meeting of the Baltimore Regional Safety Subcommittee. We have a bit of a varied agenda for us today. We're going to talk about a few different things from state and regional and local partners. But we're going to start off with, I'm going to remind everybody this meeting is open to the public. I am recording it. The recording will be posted to our website in a couple days after this. So if you have any concerns about that, feel free to use the chat box or make adjustments, but I just wanted to let you know. And we're going to start off talking about the minutes from the last meeting. I sent out with the announcements and the calendar appointments. If you've had a chance to review them, I'm going to ask for any changes or.
But it was against the Detroit Lions.
Oh, something about the Detroit Lions. Okay. If you have any adjustments, please let me know. Otherwise, I won't ask for acceptance. I'll ask for any objections. If you object to accepting those minutes, please raise your hand or put something in the chat. And I'm not seeing anything. All right, so I will take them as accepted. Thank you very much. And now we'll kick off our presentations, and I will pass it over to, is Myra here? Sorry, I'm scrolling through my list. Oh, I don't see Myra on yet. Tim, did you want to do it for her, or should we can skip around and come back to Myra?
Are you asking me? I'm sorry.
Yes, I'm sorry. I saw your video came up. I didn't know if you were stepping in for Myra or we'll just wait.
It took me a couple minutes to get through, but I think she's probably better first than I'm trying to.
Okay, no problem. Then we will come back to her once she signs on. So if it's okay with you, I'm going to pass it over to our partners at MDOT State Highway Administration. Is it okay, Acute, for you to go now?
Yes, Cindy. Okay.
All right. Let me find your presentation.
Sure.
Wait a minute. I have to stop sharing and reshare.
Okay.
Sorry, I'm usually better at this. I apologize. There we go.
Yeah, there we go. Yep.
Perfect. All right, go for it.
Thank you. Yeah, thank you, Cindy. Thank you, everyone for giving me this opportunity to present VRU safety assessment. My name is Achyut Nevpani, and I'm a multimodal team leader at Maryland Department of Transportation Highway Administration's Office of Traffic and Safety, and I'm a project engineer for this Maryland's 2025 VRU safety assessment. I'll be sharing an overview of a VRU assessment, what we've done so far, and what's the process behind it, and the progress of it. So I'll be doing very quick, and most of you, if you have joined the consultation meetings or participated in other surveys we conducted during this process, you might have some idea what's the VRU assessment is, but I'll give you a quick overview through this presentation slides. Can you move to the next slide? Yeah. So the purpose of the VRU assessment update is like, first of all, I'll tell you, if you don't know, like VRU is the short form for the vulnerable road users. For those people who are someone who is walking, cycling, and rolling. These are very much susceptible to being killed or injured in the crashes, other than the vehicle itself. Um, so we evaluate the ongoing safety performance of the pedestrian and bicyclist and update our plan to improve safety for these travelers throughout the Maryland. And VRU is regardless of the jurisdiction, so it will be covering all the roadways in Maryland regardless of jurisdiction. Next. So um, for this BRU safety assessment, federal guidance requires us to conduct this VRU safety assessment and being updated alongside with the strategic highway safety plan, which runs on a 5-year cycle. So we are updating it now for 2025 cycle. Uh, Although the initial assessment was conducted just 2 years ago in 2023, this update aligned with the strategic highway safety plan cycle. So going forward, the VR safety assessment will be updated every 5 years with the strategic highway safety plan. So which will be the next update will be in 2030. Next. VRU safety assessment support different other initiatives throughout the Maryland State Department of Transportation. As you know, Maryland is a Vision Zero state. We are committed to eliminating roadway fatalities and serious injury by 2030. The VRU safety assessment supports Maryland Department of Transportation's other ongoing initiative towards that goal. One key initiative is Complete Street, which is implemented statewide to prioritize safe multimodal options, including people who are walking and biking through all the phases of the project development. And the assessment also aligns with the Serious About Safety initiative, which is strengthened the MDOT's commitment to reducing the fatalities on Maryland's roadways. Next. Um, Talking about the methodology and process, the process begins with the data from the several MDOT offices to understand the existing condition. From that, we identified areas of need, then narrowed them to priority high risk area statewide. Um, to complement that data, we gather public feedback through survey, highlighting where the people want safer space for walking, biking, and rolling. We also held a 5 stakeholders meeting, um, which has done in the last month of July, meeting across the state to get input from um, all the stakeholders and interested parties on the high risk areas. Next. Um, so this is more like the areas of need methodology. I'm gonna talk a little bit about this one. So how we come up with the areas of need. So to identify the areas of need, we analyze the crash number and severity along the public survey input, other community factors, short trip opportunity areas. These are the uh, different layers of the data. We superimpose those data and did the high-level GIS analysis um, to get all those areas of need. And for each SSA district, we find out the 5 um, areas of need, which are more prioritized based on those data. Um, the methodologies, what we used in this BRSS safety assessment is which follows the previous assessment as a BRU assessment in 2023, also in the same methodology used in PSEP, but the data and uh, other aspects are a little bit different than the PSEP. Using this data, we identify 5 geographic areas with the highest overlap. Um, so that's how we get these areas of need. Next. To get these areas need we use the comment density. So we conducted online public survey from December through January. It was 2 month window for the public, inviting input on the roadways or facilities with the safety concerns and suggested improvements. This was interactive GIS web page, which we shared for the survey throughout the Maryland last December and January of this year. And public comments from the survey were used to help identify areas of need. The map you see here shows the density of the comments what we get from those public survey in each SHA district. Next. So the next criteria was the community factors. Demographics were another key factor in defining areas of need. We scored Maryland Census Tract on multiple demographic measures with the points for the factors above the statewide average. Higher scoring areas tend to rely on the people who are relying on walking, biking, or using the transit. So investing in safe infrastructure here helps connect the residents to those opportunity safely. So that's how we come up with the using the community factors. The next layer was non-fatal, non-motorist crash density. So crash location was another key factor in defining areas of need. So this map shows the density of non-fatal, non-serious crashes in Maryland over the last 5 years. We used the 2019 to 2023 data. As expected, higher density tend to occur more populated areas. You can see in the map. Next. Other criteria was the serious and fatal crash density. So this map shows only the serious and fatal pedestrian and bicyclist crashes. Um, it's like the previous map, but you can see the rural suburban area are more likely appear here than they did it looked only on the non-fatal and non-serious injury crashes. Next one. Um, One other criteria is short trip opportunity area. This is another factor considering identify the areas of need was MDOT's short trip opportunity areas. We also known as STOA, STOA. Um, there are places where the people have strong potential to replace short driving trips with walking or biking with a safe condition. The factors MDOT use define the short trip opportunity areas include the employment and population densities, schools, transit, and the number of zero car households in that area. Finally, we layered all these data sets to identify the areas of need. The map shows the result. Here, you can see the pink areas are the areas of need, and the blue areas were the uh, previous round of VRU safety assessment in 2023. We got those areas of need. There's a little bit changes in the areas of need since 2023. You can see in the map. Next. So, so with that areas of need identification, we used prioritization analysis to score all the SHA and local roadways in each areas of need based on the factors shown here. Like these are the non-fatal, non-motorized crashes, serious non-motorized crashes per mile. These are all the above average, statewide average data. So community factors, short trip opportunity areas, HSIP program data, 1.5 mile rail transit, walks it, bus stop density above the average statewide data. SHA bike spine. Also, we use the school proximity. Um, so these are the factors we use to score uh, the the roadways within that areas of need to get the high risk areas. Uh, so the highlights only this only highlights the top segment of our by our methodology. It doesn't capture every roadway with the VRS safety risk, and other corridors may be prioritized through state, district, or county or local programs. So that means like it won't cover all and every roadways which has the higher risk, but with this methodology, um, we believe we captured most of it. Next. So once we get those high risk corridors, we held the consultation meetings to hear from all the stakeholders or interested parties. We held 5 consultation meetings across Maryland with a range of stakeholders like county, city, MPOs, advocacy groups, towns, and VR representatives. Um, the goal was to hear their safety concerns and to gather the input, what type of improvements could be the best solution for those roadways we identified as high risk corridors. So this is how we did the consultation meeting. And also, can you move to the next slide? Other than that virtual consultation meeting, we did online survey. It was, you can see on the screen, it was a online survey, GIS based online survey. Uh, from there, participants uh, can give their feedback on the specific corridors, focusing on pet safety and cyclist safety, and what kind of improvement they would like to see. So we get a pretty decent amount of feedbacks for these corridors through our online survey too, and also we get a lot of uh, concerns or feedbacks through our consultation meeting also. Move to the next one. So yeah, this is just showing the high risk areas in District 4, which is Baltimore and Hartford County. For Baltimore and Hartford County, 28 corridors identified as the high risk corridors. Most of these are clustered closer to the city, with some notable exceptions are there. We grouped these corridors on the subsequent geographical uh, kind of geographically, but not the score wide or any uh, ranking based. So um, these are the corridors. You can see it for the SHA District 4. Can you move to the next one? Yeah, this is the, you can see on the screen, these are the high risk areas in Baltimore City. We identified 20 corridors in Baltimore City. Um, just like within counties, we grouped this closely from west to east. These are not the ranking itself. Move to the next slide. Um, so the next step for the VR safety assessment, we collected all the inputs from the stakeholders consultation meetings and online survey. Um, we will consolidate those inputs from all those meeting and online surveys, and also we get a lot of feedback through emails. Also, we'll summarize those feedback to include in our final report, and we are on the process to prepare the final draft report and also once we complete this, we'll submit it to the governor's office for their review and approval. And once we get this done, and we'll submit to the Federal Highway Administration for their concurrence. And by the end of this year, it will be published. Um, the report will be published as an appendix to the Strategic Highway Safety Plan, so which is end of this year. So that's the plan. So thank you, and that's the quick overview of the VRU safety assessment. If you have any questions, please let me know.
Thank you very much. I appreciate you taking time today to come and
Thank
give us an update and talk on that. I attended a lot of the meetings for across our region and the online public meetings, and they were very
you.
interesting. And I hope you felt like you had a good turnout and good feedback from folks. Looks like you got a lot
Yeah,
online, so
yeah.
that's
Yes, we got a lot from online, and also great feedback from those consultation meetings also.
good. Good. Does anybody have any questions or comment for Achyut? You can either unmute or raise your hand, whatever you like.
Hello. When are the physical improvements going to be made?
Um, that's a good question. It will be published by the end of this year, and implementation is kind of tricky. We have gone through for the state level. We are in the different phases of PSTEP and VRU corridors, in the different uh, stages of implementation. Also, some of the counties, they have done their own implementation plans, and city might have their own, but there's no timeline. But they can start as soon as possible. Like um, once we complete this analysis, and it will be published to the strategic highway safety plan, then um, they can start doing the implementation.
One more question. Does this have to be identified as a capital project?
Mm, I'm not sure. Basically, there might be overlaps, but I would say will be different than the capital projects.
Okay, thank you very much.
Thank you.
I have a question. Um, so once this report is published, will there be some coordination or some reach out to the different jurisdictions for the improvements? Because it's going to intersect with some of the local roads from that list that you posted.
Yes.
So just out of curiosity.
This is Peter Campanitas from State Highway Administration. So there is going to be, I would imagine there would be some coordination depending on the scope and scale of the location. Just kind of piggyback on to answer a question that I think Elizabeth Ward had asked. Some of this stuff is probably going to require some geometric improvements. Some of it's going to be obviously involving additional traffic control devices in the way of possible mid-block crossings, enhancing the existing traffic signals to make the intersections more accessible. It's going to be from uh, the simple to the sublime. It's gonna be um, that's the way these pedestrian safety action plan projects have been. This and to some degree, we have a list of vulnerable road user locations where uh, Some of them are going to be quick fix, some of them may be more involved, but what they're not going to be are streetscape projects. They're not going to be, they're not going to get into that level of detail. Um, we're talking about rudimentary, relatively quick fix type improvements that should require little or no right of way associated with them, because that a lot of times those plus potential environmental impacts can really increase the cost as well as add add time to design uh, of a project. So we're still, in a manner of speaking, building the plane as we're flying it. When we're trying to find different ways um, of trying to implement these improvements uh, in a timely fashion. But what we're finding is that a lot of our roadways, at least on the state roadways, are relatively wide, and we're trying to figure out how to make the footprint at least a little bit more inviting and safer for vulnerable road users.
Yes, thank you, Peter, for
Sure.
answering that question.
Any other questions about the vulnerable road users assessment? Great. Well, thank you again for your time. I
All
really
right,
appreciate
thank you.
it. This is a great effort. And it, like you said, it dovetails into a lot of other things with the PSAP, the SHSP, and a lot of other things.
Yes,
So thank you.
yes, thank you. Thank you, everyone.
All right. Now I will hand it back over to Miss Myra Weeman, our Deputy Director of our Maryland Highway Safety Office.
Thanks, Cindy.
Go for it. Thank you, ma'am.
All right. Good afternoon, everybody. I'm going to provide updates on 3 areas today. First of all, I'll talk a little bit about where we are with the Strategic Highway Safety Plan and what we've done to date pretty quickly on that one. I'm going to give a brief overview on the Vision Zero meetings and our next one coming up. And then I will touch on some of the new laws that have gone into effect either July 1 or will be going into effect on October 1 that will affect the Baltimore metropolitan area. Okay, thanks. So first of all, for the Strategic Highway Safety Plan, we are in the process of writing the update. This new one will cover 2026 through 2030. I know most of you, if not all of you on this call, are familiar with this Strategic Highway Safety Plan. If you haven't seen it, you've heard of it. It is plain and simple, a statewide plan to make all of our roads safer for everybody in Maryland, for all road users. And the goal of this plan is to bring together all the different groups, advocates, police, engineer, health experts, and the list goes on, to create an overview. This is almost like an umbrella plan to provide some strategies and to lay out what our emphasis areas are here in the state of Maryland. Truly, it's identifying the biggest issues that we're seeing here in the state based on the data that we've reviewed. And then we're also going to be setting some goals within the Strategic Highway Safety Plan. One more quick thing on the Strategic Highway Safety Plan. Sorry about that, Cindy. As we were developing it this year, we did a couple of new things, and one of those was to hold 4 community meetings. And we held one in the western part of the state, out in Cumberland. We held one in the southern part of the state on the eastern shore, and we held one in Baltimore County. And we received a lot of update from those people in the community, as well as traffic and transportation officials that also attended those meetings. We had an area on our website, 0desmd.gov, where people could write in their comments. We received quite a few comments on that as well. So all of that information was reviewed, and most of that information was incorporated in some form or fashion into the draft plan. The draft is now being circulated among many different stakeholders, waiting for feedback on that. And then from there, we'll finalize, and within the next probably 2 months, we should have a plan ready to submit to Federal Highway. Next. A quick update on our Vision Zero public meetings. For anyone that isn't aware of these meetings, they are required by legislation. And the requirement is that the Maryland State Vision Zero coordinator, who is our director, Dr. Tim Kearns, is to collaborate with state and local agencies on all of the traffic safety efforts. So pretty much hand in hand with the strategic highway safety plan are these public meetings that we can give updates on where we are with fatalities and serious injuries and the initiatives that we're working on to reduce those numbers. The public meetings are held quarterly, and a lot of the content of the meeting is a review of the pedestrian fatality infrastructure reviews. Most recently, there has been a request to vote on the findings of those pedestrian and bicyclist fatality infrastructure reviews. So that is now also a part of those meetings. And during those meetings and during those reviews, the 4 big items that are looked at are the highway maintenance, engineering upgrades, whether law enforcement needs to be enhanced for certain areas where we're seeing an uptick in fatalities. And of course, as always, what are our education campaigns? Can we make changes to those campaigns? Can we improve those campaigns? And where should those campaigns be deployed? Next. This is just a real simple screenshot, actually, of the pedestrian and bicyclist fatalities infrastructure review. I know that's a mouthful website. As you can see, they're all plotted on a map, and there is what is called a summary assessment attached to each of these items. So I just clicked on one so that you could see how the summary assessment populates in a sort of pop-up box. At the very bottom of that box, you will see a link that takes you to the actual infrastructure review report. Cindy, if you could go to the next slide. A sample of that report would look like this, what you're seeing on the screen now, where all of the initial findings and recommendations are listed in this report or review. These aren't the reports aren't shown on the screen. What takes place is there is a general overview of these reports. There is a list of reviews ahead of time that we know are going to be reviewed. And then during the meeting, we have a lot of conversation back and forth about what took place, what was found by State Highway when they went out and did these reviews. Next slide. So if you are interested in attending one of these, they are virtual, so very easy to attend. You can find them located on our website, 0desmd.gov. You can go to the taskbar at the top and click on Highway Safety Office. Scroll all the way to the bottom of that where you see Vision Zero. And then on the Vision Zero page, you will see the public meeting schedule. There's also recordings of past meetings in case you want to see what takes place at the meetings before you sign up for the next one, which will be October 16th of this year. Next slide. And last, I just want to cover some legislation that our office was following closely, and legislation that deals with driver behavior, pedestrian, and bicyclists. The ones that I've listed in red denote an MVA departmental bill. So we'll start with the first one, House Bill 46, Senate Bill 222, which was titled the Cannabis Public Health Advisory Council Bill. This pretty simply adds the administrator of the MVA, which is Chrissy Nizer, as a member to the council. So prior to that, there were quite a few representatives on this council, but there was really nobody that was representing traffic safety, driver safety, and that's why we put in this bill, and it was passed. House Bill 189 and Senate Bill 187 deals with commercial driver licensing and disqualifying for drunk driving. So therefore, if someone with a CDL is driving and found with a BAC of 0.08 or higher, they will be disqualified from operating a commercial motor vehicle for 1 year. Again, that was an MVA departmental bill. Senate Bill 207, another drunk and drug impaired driving bill. This one has to do with leaving the scene. And again, a license revocation. MVA can revoke or will revoke the license of anyone convicted of impaired driving if they contributed to a crash or if they failed to remain at the scene and that crash results in death or a life-threatening injury. And then last on the driver behavior related bills is House Bill 744, Senate Bill 590. That has to do with reckless, negligent, and aggressive driving. This was named after Sergeant Patrick Kep, who is the Montgomery County police officer who was involved in a driver hitting him while he was at a traffic stop and unfortunately lost both of his legs in that crash. This bill specifically adds many more traffic violations that are now considered reckless or aggressive driving. I just was going to list them all, but there are so many. It would probably, if you're interested in what all of those are, it would be better to just look up either one of those bills and it lists all of them out for you. It's also going to enhance the penalties. There's more points assessed for reckless, negligent, and aggressive driving. Next screen. For our vulnerable road users, legislation House Bill 375, also called Jay's Law, which is named after a gentleman in the committee who's very passionate about this bill. This authorizes bicycles. They call it play vehicles, so that's something like a scooter or a unicycle. They're allowed on sidewalks unless a local ordinance prevents it. So, for instance, Ocean City is looking at the pros and cons of allowing these types of vehicles on sidewalks. So if they do determine that, for everyone's safety, it would be better to not have them on the sidewalk, they, of course, will push a local ordinance, which will then take precedence over House Bill 375. Next screen. And there were many, 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 many bills regarding speed monitoring and automated traffic enforcement. I only pulled out the specific bills that I think would be pertinent and relevant to this group. The first one is House Bill 913, and this deals with the speed monitoring cameras on Interstate 83, and it increases the number of cameras from 2 to 4, but only one camera in each direction of I-83 can be operational at the same time. The next bill, Senate Bill 338, deals with Baltimore County speed monitoring systems on Interstate 83, and that's the portion of I-83 that falls in Baltimore County. So that's a little different than HB 913. And then the speed monitoring cameras on I-695, only the portion that falls within Baltimore County. And this legislation allows up to 3 cameras in each direction on I-83 in the Baltimore County portion, and then 4 in each direction on I-695 in the Baltimore County area. Senate Bill 600 is a stop sign monitoring pilot. This is going to take place in Tacoma Park and Baltimore City, and it simply permits the use of an automated stop sign monitoring system, but only in certain school zones. And just a note on this one, before they can begin the use of these, they must publish a notice on their website and in a newspaper in the jurisdiction where the system is going to be used. And that's it for my legislative update. There's my information if you have any questions, or we could take questions now, Cindy, based on timing.
Great, thanks, Myra.
Sure.
We'll add just a little note along with the Vision Zero stuff, Vision Zero meetings that Myra discussed. We did have a presentation to the BRTB recently about all of this. There's been some discussion about potentially involving some of the local partners if it's a crash that involves a local road. There are fatalities on state roads, but sometimes they intersect with local roads. So as those come up, you may be hearing from the Highway Safety Office or from the Vision Zero coordinator if there's any insight from the locals. And then the other thing is, one thing we're doing here at BMC is we're going through those recordings once they're posted of those meetings, and we're time stamping whenever a case is discussed in our region. So I believe we've made that list available to the board members, but we're also going to find a way I'm either going to send it to all of you directly, or we'll have it a running list on our website. So you can always go in and check and see if there's one in your jurisdiction, you can hop right to that timestamp. But we do appreciate all the involvement of BMC and the BRTB in those meetings. So thank you.
And Cindy, if I could just add one more plug here. We have quite a few work zone brochures. It's just kind of a tall card with a lot of information on the new fines in the work zone areas, the increased penalties when workers are present. We have them in English and Spanish. And if anybody on the call is interested in receiving some of those, please reach out to me and we'll work out a way to get those to you. I should have had a picture of those, but I thought of that this morning.
That's okay. That's great to know. Thank you.
Yep.
Any questions for Myra about any of she covered a lot of stuff, or other Highway Safety Office type questions? Oh, something popped up in the chat. I wonder why the state would legalize cycling on sidewalks versus building out statewide bike lanes. Is a question we got. I'm not sure if that's better for you, Myra, or one of our engineering partners. If anybody has a comment on cycles on sidewalks as compared to building board bike lane facilities.
I am not sure who the sponsors of that bill were. That was not an administrative bill from
No.
MVA.
Or SHA.
Or I was getting ready to say that, Peter. But Peter, obviously the statewide bike lanes would be quite an investment financially, right? I don't
Yeah,
know.
I mean, it is law, part of the vehicle, the Code of Maryland to provide bike lanes when improvements are being made, when the curbs are being impacted to provide for compatibility to have continuous bike lanes. Unfortunately, it is expensive, but we do whatever we can either through projects, SHA projects, or through developers to incorporate them. Um, the you know the we also but we also are um, constructing shared use paths, and really, we have the bike lanes obviously, but the shared use paths are facilities that um, are better for any user. And so it isn't a one size fits all. We're trying to accommodate both types of uses. Now, sidewalk, I get, grant you sidewalk because of the narrowness of it. It's not most ideal, but for those who are um, your novice bicyclist, it depending on the type of roadway you're talking about, safe it can be safer than being on the road itself, especially when there aren't any shoulders available.
Senator Waldstreicher had the Senate version, and a whole host of delegates had the House.
Hi, everybody. For those who don't know, I'm with the Highway Safety Office, but the pedestrian and bicycle. And the advocates worked along with the MBPAC, the Maryland Bicycle Advisory Committee. And if you listen to some of the hearings, one of the big things was that the bicycles are definitely to yield to the pedestrians. It puts the bicycles in a safer, separated from traffic when there are not bike lanes. But re-emphasizing that they are still to yield. So one of the things that's talked about in that community is that when you're the bike on the sidewalk or bike on a trail, you're kind of the bigger threat, as opposed to when you're on the road, you're the lesser threat. So it was just a way to make those who aren't those fearless and confident bike riders another safe option to ride.
Great, thank you all.
Cynthia, I forgot you listened to all those. I should have punted the ball over to you.
And
quite all right, yeah.
And Corey asked a
the
question.
Sorry. I was just going to say, in listening to all the advocates, there's a lot that went on behind the scenes too. So happy to answer that question or hopefully provide some perspective.
And Corey had asked the question and he said, thank you for those responses. So I appreciate that. Any other questions for Myra or her highway safety colleagues? Great. Well, thank you for coming out and taking time to do that today, Myra. I appreciate that, especially as we get ready for laws to take effect. And it's our 5-year cycle. We're about to get a new SHSP, so that's exciting. Thank you.
Thanks.
All right. So now we are actually going to move on to, if I can find my presentation. I'm going to give a brief presentation on a project we have going on here through BMC. Some of you may have heard of this already. Some of you have gotten messages from me, but we're very excited this year. We received funds through the Highway Safety Office for providing bicycle helmets and bike lights for outreach programs across the region. So we're not necessarily conducting the programs here at BMC. We're kind of just providing that resource. Let me check. I hear a little bit of background. Okay. So just to give you guys a little bit of a quick overview, we have about almost $30,000 in the grant for helmets. And the purpose, like I said, is to support outreach programs. We're looking at riders of all ages. And we want to promote safe practices in helmet use. So even though the law doesn't directly apply to and require adults to wear helmets, we're still promoting that as a safe practice. And we're not just focusing on any particular age group or type of person. We want it to be a region-wide approach. So I'm trying to encourage folks from all of you from your jurisdictions to find partners on your safety plan teams or just other general partners that might be able to use these. and also foster those new programs and new partners and bring them into the Highway Safety Office's fold. And we've heard from Cynthia Spriggs already, the ped bike coordinator down there, and she's definitely with me that we want to expand the use of this and get more helmets and lights out there for safer riding and promote bike riding for health reasons and everything across the region. So what it is, the plan, the process, we are finishing up the first quarter of the grant. So worked out a few kinks and coming up with some different ideas to be able to stretch the money as far as we can through the rest of the grant year. I'm going to send out a message to each of the safety teams and any other partners that come on board and tell me they want to be on the distribution list. I'm going to send a message out quarterly and see if you have any events coming up, anything planned where you would want helmets. We are looking at events to focus on that if you have them out there. The form you'll see asks for a date and date, location, anticipated audience. So it's not really necessarily to just let you stockpile helmets to use when the need comes up, but it's if you have a bike rodeo or a back to school event or something already planned where you know you'll have that interaction and folks coming to you. We want to cap each request at 150 if possible, as a way to try to stretch that money. Like I said, the grant is through next June 30th. The way it does work is they get shipped directly to you. So it's not that we have a storage space here at BMC and you can come pick up whatever you need. So if you want larger orders, if you have big events coming up, folks have asked me already, how many can I request? And I said pretty much what you can store up to 150. So that's just something else to keep in mind, that these are direct shipped to you. But we place the order, we pay for it. You don't have to do any of that stuff. It is also available to you to get educational materials, things from the Highway Safety Office. We have different materials from our Look Alive project that you'll hear about in a second, a little bit more about that. And if you want in-person support for that, that is possible. We can try and make those arrangements if you want somebody to come to help fit the helmets or talk to your team about a few things. Connor, I see your hand is up. Did you want to say something or?
I had a quick question.
Sure.
Are these, I guess, adult or child size? Because we get a lot of requests from our school system for this kind of stuff. And I'm curious, what will that go and factor into the order?
So it's a range of sizes. And I may ask Cynthia to tune back in to help me with this because I won't remember off the top of my head. We can get toddler size helmets, but the adult size helmets, even the adult small, will probably fit elementary school children, I believe is how it goes. Is that right, Cynthia? So I don't get it wrong.
Yeah, I'll jump in and help you out with that one. So yeah, a lot of people think toddler helmets are going to fit kind of your early elementary up to early elementary, but some of our early elementary, even young as first grade, may need an adult medium. So once you get the information from Cindy and you want to order, you're more than welcome to reach out to me if the school doesn't already have the information that they need. And I will say I offered this to one of the jurisdictions that's on the call today. They would like to hand out helmets, but they don't know what a proper fit should be. And unlike car seats where you have to go through a training, there's no training for helmets, but I have some materials that can help to make sure it's thoroughly explained so that when you are providing these helmets, they're provided with the correct fit and correct information to pass along to the families.
Great. Thanks, Cynthia. And I do have some like measurement tip things that have come from a couple of the vendors that we get bids from. So that'll be included in the form when I send that out, Connor. So that can also help give you either a typical age range or actual measurements. And they are adjustable helmets too. So it has some wiggle room, literally.
Great, thank you.
Sure. Okay. So this is what the order form looks like, or the request form. So you can see, just aside from shipping information, because it comes directly to you. And then, like I said, we want this to be as event focused as possible. We understand that you may have an event, say you order 100 helmets, but only 50 get distributed because of whatever reason, or the event doesn't happen or you can't attend. That's totally fine. You keep them and we just say you're going to hand them out in the future. It's not like it has to be that exact number at that event. But we like that as a way of trying to look at where the helmets might be going, the types of things. So it also helps as we try to grow this program to either put on more events like that or find more partners that would be interested. Here's just the rough range of what we ask. But like I said, and Cynthia said in answering Connor, we'll also have some tips and tricks on there about what a toddler, adult, small, medium, and large would look like. And then you can request some bike lights to go with it. We have a smaller amount of money for bike lights, but we do have them there. And also, like I said, educational materials or an actual person, whether it's Cynthia or somebody else, one of our partners that can come out and help support you. One thing I do want to say, I'm doing the quarterly message, so the next one will go out in the beginning of October. I please ask as much as possible that you plan ahead for your event. We understand sometimes things crop up or you get brought on to an event, or it might be a short time, but I just want to let you know that there are several levels of approval we have to go through because these are grant funds. And then just the time it takes once we place the order for the delivery to occur. Sometimes we've placed a few of these already for some of our partners, and it's been a week sometimes to actually get at your doorstep. Like I said, it's a state grant, so we are tracking all of these things. The other thing we have to do is we want to be able to evaluate the grant to then help it grow and make it better in the future. So one thing I do ask after your event happens, I send you a feedback form. So when I send that, again, it's just like, again, what event was it? That way, if your initial event didn't happen or it got changed or something, you can let me know, this is the event we actually did. These are the helmets we actually distributed. So like I said, if you had 100 helmets, but you only were able to give out 50, then just real quickly, what are your plans for the remaining helmets? If we're just going to work as with the school system as the need comes, or we're going to do another bike rodeo in a month, whatever it may be. And then also just a little bit about the folks that you worked with and the people that received the helmets, just their kind of age range. If there were any other languages, what the primary languages were spoken by the participants, that'll help us develop more multilingual materials in the future. If we see a lot of things come back, we have things in English and Spanish, but we know there's a lot of other languages spoken out there across our state and our region. We want to be sure we help everybody. And then if possible, but of course, parental permission or your level of comfort, or if it's even possible, a few pictures, even if it's just of the setup, something like that. We all love pictures to be able to see and brag on all of your good work, but that's only if possible. We understand that. So like I said, I'll be sending out messages quarterly. If any of you on here haven't heard of this yet, weren't on my initial one that I sent out last month, or I guess it was in July, shoot me a message, drop me a line, let me know, and I'll put you on the list so you get it every time. We are trying to plan ahead with May being Bicycle Safety Month. So we want to make sure we hold enough so you can have orders and events there. If you already have an event planned for May, you can already put the request in. That way it's on the books, we have it accounted for, and that's fine. We won't actually ship you the helmets until closer to the event, so you don't have to worry about that storage problem, but it never hurts to plan as far ahead as you like. This project will run through June 30th. It's a fiscal year project, and in that time, we work closely with the Highway Safety Office, but we'll be in discussions on what it could potentially look like if we apply for more funds next year to continue it into 2027. And that's pretty much all I had for this one so far. I'm not sure, let me check our list. I'm not sure if anyone was able to join that had already gotten some helmets. We had some that made it down to Anne Arundel County Fire Department, Carroll County Public Schools, Baltimore County Fire Department. We've had a few different partners already out there hitting the streets. So if you wanted feedback from somebody that's actually been on the receiving end of the program before you make a request, I can certainly hook you up with them if you have questions. Any questions from anybody or any additional thoughts or anything, Cynthia, about Highway Safety Office perspective on this one?
The only thing I'll throw in there is for educational materials. I definitely would appreciate at least like 2 weeks, maybe even more depending on how far away you are for shipping or getting that information to you. I typically I have a lot of them on hand, whether I'm out and about in the communities or at the office, but just allow for that shipping time to get it from my office to you guys.
Yeah, thank you. And for those of you that may have friends or partners in other areas of the region, there is a similar project going through WABA, the Washington Area Bicyclist Association. So if you have friends or partners down in PG or Montgomery County or other parts of the Washington region, they can reach out to WABA and have the same process and availability.
Cindy, I'll just throw my email in there. That way they know who to reach out to at WABA, and I'm happy to make the connection. WABA's in connection or in partnership with Bike Maryland. So I'm more than happy to help connect that.
Great. Thanks, Cynthia. I appreciate that. Anybody else have any questions or thoughts on this one? All righty. Well, then I will pass this over and stop sharing and hand this over to our partner who's actually across the table from me, but we'll get into that later. And give it over to Kenna, who will talk about our Look Alive project.
You should be. Good afternoon.
Sorry, go ahead.
Are you okay?
Yes.
Cool. Okay. Let me know if you can't hear me, or if there's any issues here. And hopefully everyone here can see my screen. So today I'm here to share our latest updates with the Look Alive pedestrian and bicycle safety campaign here in the Baltimore region, featuring Signal Woman. And the Look Alive campaign was developed and launched in 2019, specifically for the Baltimore region by the Baltimore Metropolitan Council, funded by the Maryland Highway Safety Office. And we have continuous messaging throughout the year, but have a really big push in kind of this season, September, October. But ultimately, our goals are to educate on the education side, educate drivers, pedestrians, and bicyclists in the Baltimore area about safety tips and laws that protect people walking and biking to ultimately reduce the crashes and fatalities of pedestrians and bicyclists on Baltimore area roads. The campaign stars Signal Woman, who is the pedestrian icon in a signal, who magically appears and dishes out safety advice in addition to telling people when they can walk or not walk. The campaign is fully integrated with all sorts of components, and we really push hard in September and October, because as we go into fall, I don't know if you've been noticing, but every day the sun sets a little earlier in the evening and gets up a little bit later in the morning, until until December, when it's fully dark and we all have seasonal depression disorder. But that is really problematic for visibility issues. And we see, when we look at the data, that the crashes for pedestrians tend to start increasing in September, usually peak in October, and continue to be high through the end of the year in the winter months. So it's really critical that we get out there in this most dangerous time of the year for people walking and biking. And we do that in a variety of means. We have Paid media transit is really important because it really reaches drivers and transit users as they're getting on and off the buses at a place where they're crossing paths. And so we just posted bus ads on MTA throughout the region. We also and that will be running in September and with overrides into October. We also have digital mobile media buys, and we focus really hard on video because that's the most engaging media online. And we have these great Signal Woman videos where she really gives complicated traffic safety advice that can't be plastered on the back of a bus. We also have the virtual reality challenge, which I'll talk about here in a bit. Signal Woman isn't the only safety advocate we have out there. We have Signal People who hit the streets. We have social media and partnerships. And then we pitch everything to the media to amplify that out. And so our really big push aligns with October Pedestrian Safety Month, but we're starting to trickle out many messages now ahead of it. These are some of the ads that we have on buses inside and outside. We'll have these up in some PSA format on shelters, and in addition to our video ads online and on over the top. We have Signal People street teams hitting the roads around the region. Our street teamers are bilingual. They're dressed as pedestrian icons. They wear educational walking billboard backpack banners with our campaign creative on their backs. And they remind drivers, cyclists, and pedestrians at key intersections to practice traffic safety and obey the law. We also invite media to all of these activations to amplify our audience and reach more people with this tactic. We are working with local partners to identify key areas to place the Signal People street teams, and we'll have a flurry of activity in October with street teams on October 7th and 8th, and also on the 25th in Baltimore City, Baltimore County, Anne Arundel County, and Howard counties. We also have the virtual reality challenge. I think I've presented this before at this particular meeting, but it is, in case you're new, it is an activation that travels around the region that uses virtual reality to really put the participant in the driver's seat, but also let them know as pedestrians these three common high-risk scenarios where crashes can often occur. With pedestrian safety, there are a little more nuanced situations where people just don't know. Like you need to be looking for people walking and biking as you're making an unprotected left turn at a signal, turning across a bike lane, or stopping at a crosswalk that's unsignalized. If someone else stops at a crosswalk, you need to stop too. So these are things that are a little more complicated than what the public has patience for consuming in a safety tips guide or in a on a bus ad. So this really allows for deeper conversations, more experiential learning, and the participants' experience is projected onto a large screen. So people around can also participate in that learning as well. Alongside the virtual reality exhibit, we have a giant tips wall and also a photo booth where we take Polaroids and people use our signs that have safety, fun ways to talk about safety, with the signal box selfie there. And we are taking this on the road in FY 26. Our first event is upcoming next month, the Young Driver Safety Program in partnership with Baltimore County Police Department in Owings Mills. So we're really excited to bring that back. We've been to that event, and it's been really successful there. So if you're around, come check it out. We've also really doubled down our efforts to incorporate partners and local jurisdictions into the campaign to amplify messaging and leverage their channels and also provide resources to the local jurisdictions and integrate with their state, their local SHSP efforts. And so this past year, we've had a lot of calls and planning meetings. One of the things that we are offering to partners, both on the local jurisdiction side or any other partners, that if there is donated media like bus shelters or transit agencies that have space on the outside of their buses or the inside of their buses, that's such a great, important place to be reaching both drivers and pedestrians. And we have some really cool partnerships that are coming out. Anne Arundel did some special measurements. They don't even sell ads on their buses. So we're getting some exclusive space on the outside of their buses, in addition to the paid program that we have going on. So if that's something that you have access to and you want to have some of Signal Woman's messaging or Look Alive messaging, we can resize, tailor, co-brand the pedestrian safety messages and get something that works for your jurisdiction. We also have created a new event toolkit for the local partners that if they have opportunities to be set up at a school fair or a national night out, or these opportunities where maybe we don't have the resources to come out and staff and have a presence there. We have created some new engaging materials that can be used in your own efforts. And so we have a spinning wheel, like a Wheel of Fortune, with trivia, with the answer key on the back. We have a See Me in the Crosswalk portable photo stand with the face cut out where people can actually become Signal Woman, and a branded tablecloth, and then an event guide with talking points and other critical information about setup and such. Sorry, my throat is getting so dry. And we have so that we have this available for partners. Any of you who want to take Look Alive to a specific audience. We're still working out the details, but I believe that toolkit will live at BMC, and Cindy will facilitate the use of that. So yeah, ping one of us if you are interested. We are taking this out. It's having its debut today. We will be unveiling the toolkit at Bard High School in Baltimore City for a back to school night. And that is tonight from 5 to 7. So we're excited to see how folks engage with both the photo op and the spinning wheel, which has trivia and makes it a little more engaging. We've learned that oftentimes if you phrase safety tips in the form of a question, sometimes it sticks a little bit better because they have to think about the answer. And another resource that we have started creating and distributing is a monthly social media toolkit. And that really is creating and distributing customizable content for our partners to really easily plug in to promote pedestrian and bicycle safety on their own channels. So whether that's the police departments or we have a Baltimore County Fire Department, the transit agency. So we're reaching out to those groups to give them content to put on their social media challenges. It has channels. They have graphics and videos and tips with suggested captions and copy that can be customized if desired, but it's all designed with social media best practices, proper sizing, hashtags, and copy that can easily be plug and play where folks can use it. We have some really fun videos and educational content as well. So if you're interested in that, we are distributing that. We just started in August, and we're gearing up for Pedestrian Safety Month as well. So if you're interested in that October Pedestrian Safety Month toolkit or ongoing content, let us know and we'll add you to the distribution list. And then finally, nothing matters if you aren't evaluating what you're doing. So this is just sort of a comprehensive approach to evaluation and reporting. We do an annual post-campaign online survey after our October push with segmented into drivers and pedestrians, transit users in the region to measure awareness and relevance of the ads. And that is in addition to our success metrics like the publicity value and reach of our news stories, the number of media impressions from all of our digital advertising, outdoor media, over the top, connected TV, and then number of involvements and on the digital side, so people who are clicking, watching the videos to completion, commenting on social media or social media ads, sharing. Then, of course, our partners amplifying, campaign messaging, getting those PSAs up, and the estimated number of people outreach activations, conversations, engagements that we have with them. And then we also do a post survey for participants at our virtual reality events as well, just to measure that impact and evaluate how the program is doing. So I think that is my my short long overview of the of what's happening next for the Look Alive campaign.
Great, thanks, Kenna. And sorry if there's a little bit of an echo there. I unmuted before she was done talking, and we're in the same room. Are there any questions or comments for Kenna on Look Alive? I'm not seeing much come in. You guys will hear from us after tonight, after we try out that event in a box or event toolkit, whatever we officially call it. But and once we get that here in-house, which will be in the near future, we just have to get through tonight. I won't promise it'll be in the next day or two, but we'll set up. We've talked to some of you about this already, that it was coming, and if you have events you might want to use it at. It is very mobile. It can fit in a bag that you could carry on your back if you're in the mood, or a quick, easy little pull along. But you don't need a big SUV or a truck or anything to load it around. It all folds up very, very compact. Mike, I see you're on screen. Do you have anything?
Yeah, I would just say I'm glad to see Signal Woman is alive and well. Hi, Kenna. And and it all looks very familiar to me. So, but at any rate, I just thought I'd check in and see how, see how Signal Woman is doing. But it is kind of like it's kind of like Street Smart Mini Me, in a lot of ways. So, um, all right. Well, best wishes for fall.
Thanks, Mike.
And I guess for those of you who don't know, we are unfortunately Street Smart is changing consultants, so we're not working with Kenna this year, which was not my was well. Let's just say it's going to be a change of pace, and we'll see how it goes. It's been a long run. We've really appreciated all the great work that Sherry Matthews Marketing has done for us, and I was honest, I was honestly expecting that they would be continuing to do the work, but I'm not the sole decider by any means. So I think that the group has decided to go in a new direction, and so I'm hoping, we will be able to, possibly share some of the results with you, and, see how the new campaign, how our new, the Hatcher group, I don't know if you've heard of them, but they're the ones who are going to be working on the Street Smart campaign. And so maybe at some point, we'll have results that, we could possibly share with this group.
And in the meantime, we'll be taking Signal Woman to new heights here in the Baltimore region.
Well, I've always admired Signal Woman, so. Okay.
Thanks. And hopefully, I like the campaign you guys launched this year too. I keep saying that every time we have this meeting, Mike, and I will make a note to ask you to come share about it at the next meeting. So instead of people just hearing me say how it's a great new campaign, they can see it.
Yeah, I'd be happy to come and present on it. I would say that we are, we have brand new creative that was done, Life Ahead, done by Sherry Matthews Marketing, and we are going to continue using that since we certainly don't have enough time to create or money to create an all new campaign when we have, a pretty fresh campaign. But I'm eager to see what the Hatcher Group comes up with that might be, different. Because we've been doing similar things for quite a long time, and I think our results have been very good. I mean, we've got, I think, our first survey from last year with I believe it was unaided aware or no, I think it was aided awareness was 50%, which is not bad for, straight out of the box with a brand new campaign. And so I'm hoping, we'll be able to build on that and continue to get more awareness of, of our safety messages. And I would say that the new campaign, Life Ahead, there are definitely, not only is it performing pretty well based on the survey, but also it's doing better in terms of getting donated media, mostly because Fairfax County Transit, which didn't really like Shattered Lives. I think they thought it made it look like their buses were broken or something, having what looked like shattered glass on the side of their bus. And they didn't like the prior campaign either. So last fall, they agreed to run it, which makes a big difference. I mean, given how enormous Fairfax is and how enormous Fairfax Transit is, that that's a lot of exposure. And so overall, I mean, I was pleased with the results, and I don't think the fact that Sherry Matthews didn't win the rebid, I don't really think it reflects on their performance or anything. I think that there are wrinkles I don't need to explore here, but I think there was, because of the the tightening budgetary situation, we did have an awful lot of qualified bidders, for to do this campaign. So I think the competition was maybe a little bit tougher than in some previous years.
We all, everything moves and changes day to day, and we will take it. I will have Kenna sitting in my office more now. But nope, I'm glad we all still have campaigns going, and it's still a focus border to border for Maryland for sure. So, any other questions for Kenna or comments? I did see a message in the chat. City of Aberdeen's already signed on for the event toolkit. So, like I said, I'll get some photos out to you guys next week. I'll take some tonight, and so you can at least see some more of it beyond even what Kenna showed, and we can start planning ahead for using that. Okay, so now I am going to go back to our agenda real quick, if I can share correctly, because next on our agenda, I asked one of our partners that we've heard from before, all the great stuff that goes on in Howard County with their different, they do infrastructure road review, similar to what Myra spoke about with the state doing earlier. And they've been doing some road audits with their strategic road safety plan. So I asked Connor if he wouldn't mind coming back and giving us, it can be a brief update if you want. I don't want to ask him to talk for too long if he doesn't want to, about what they're doing. They're in the process of updating their safety plan. And also they have, I apologize for the typo on the agenda. They have a great SS4A project going on. Connor?
Thanks, Cindy. Yeah, I haven't prepared anything formal, any slides like that, because it's a little difficult to, otherwise I'll show you a bunch of Word documents and spreadsheets, which you guys don't want to see. But yeah, we have two big projects going on right now in terms of safety for our county, so I can touch on both of those. The first one being, of course, is our local state roadways, our strategic roadway safety plan update. So that was published, of course, about 5 years ago. And over those past 5 years, we kind of, I'll admit, we kind of struggled with implementation of that a lot. And I feel like maybe walking through what our anticipated approach is can maybe get some thoughts percolating in other local jurisdictions' head about how to approach this as well. And I'd love to hear your thoughts on it if anybody does now or later. So we came to this realization that it was really hard to focus on that implementation, and we kind of had to pivot towards different elements as we move forward in updating our plan. I don't know if it was because of the I guess the multidisciplinary nature and kind of the siloed effect of what that means to implement something from just our office being a planning, transportations focused office, and including, trying to include the police department, our fire department, our public works department, and our roadway engineers, our health department, and a lot of that various interdepartmental work is tough sometimes. But we realized we have to kind of twist our plan update into something that's maybe a little more prescriptive. So also into that, of course, our engineering element is our biggest hurdle because it costs the most capital. And as Cindy alluded to, our roadway safety audits that we've been doing kind of naturally, they've kind of transpired for our implementation work group for our past plan. We realized that's always a hurdle because of those capital concerns and the costs of changing some of the roadway geometry, as others have talked about. So we want to work backwards and develop our plan based on various elements that we kind of found ourselves doing naturally, which includes spelling out like a standard operating procedure for those roadway safety audits. I know I presented in past meetings on one right off of the Route 1 corridor on Guilford Road. And out of that, multidisciplinary disciplinary group walking around and doing an assessment of the safety of a certain segment of a corridor, we were able to actually install new sidewalks on that area and improve safety there through that engineering aspect. So I think focusing on that in the plan, in codifying some of those procedures and the strategies in more detail really helps, and really is the approach we're going to take with our update. Additionally, I really want to spell out other policies in the document themselves that focus on safety as well, that you would see in like a comprehensive or a general plan, but more focusing from a strategy lens as well. I think that would do wonders to kind of put that on paper and put that take that from a natural occurring approach that some of our departments are doing, and put that in there and take that and run with it. But that doesn't mean that we still won't have a lot of the metrics and data that gives that guiding compass, that really is at the front of those local plans that we did before. Those goals and metrics that come down from the state are really important in understanding how successful we are. And I think, but they also gave us that inclination that, okay, maybe we're not implementing this in the right way or as fast as we can. And that's where we kind of tweak that approach as well. But also what I suggest to others, I know this is not always possible, but right now we have the ability to incorporate this plan update, our safety plan update, into a consortium of functional plans that we're calling our transportation master plan for the county. And as we ramp up those efforts, that provides adequate and even focus to safety, that it may get pushed out of that. And when you're focusing on more of a transportation master plan, if it's more on that engineering side and getting into the nitty gritty on that, or if it's high level and just focusing on projects and stuff like that. So that's kind of where we're going with that. I hope that was clear enough for everyone, and especially for the local partners on here. And kind of the gist of it being that we're pivoting away from that kind of standardized implementation we did in the first part, and trying to work through and codifying a lot of these new policies as well. And then for the other big project we have going on is our implementation of our Safe Streets for All grant on the US 1 corridor, which really is kind of an offshoot of focus from our original roadway safety plan that we're doing, because it was designated as a high injury corridor on our high injury network that came out of our plan. So we were able to leverage that focus and get that federally funded planning and demonstration funds for that from the Federal Highway Administration. But what we've learned through our work, and I wish I had some more details to share with you. We're actually this upcoming week, we're going to work through some really site-specific projects with our engineers, but really focus not just on that state right-of-way, which of course, as we all know, is where a majority of all roadway really deadly and serious crashes happen, is on those state roadways, but within the corridor themselves. And we can leverage these quick build demonstration projects that are in concept and design phases right now, and get them up and running through a 2-mile buffer on both sides of that state road corridor, so we can leverage that ability to be flexible at the local level as well. So that's kind of all I had for updates on that. Let me know if anybody has any questions or comments on the stuff we got going on. Thanks.
Thanks, Connor. That was awesome, because I have on the screen, on the agenda, Baltimore and Howard County have their plans, updates to their plans ongoing. Hartford is going through an update as well. And there's some behind the scenes discussions. There's discussions within the team. So if you guys obviously can get together whenever you want and chat whenever you want. If you'd like me to put together a space to have like a little workshop or something, I can be involved or I cannot, but you could always meet here. Just let me know because I think a lot of what you said about going through that update probably rings in the heads of our partners here from Baltimore and Hartford, and some of the other ones will be going through an update in the coming year. So thank you. Any thoughts for Connor? Great, thank you. I do appreciate it. I know we're running past time, so I appreciate you sticking around, Connor, and all of you for sticking around to hear what he had to share. They have a lot of stuff going on down there, and everybody does. And maybe next time we spotlight a different county or city. So real quickly, I'll go through just the local strategic highway safety plan updates if anybody on here wants to share about what's going on. I think we do have partners from those three. But Connor, I think, probably just shared most of what he would say. I do want to pop up here real quick on the screen. I guess I'll go ahead and toss it to Baltimore County first. If there's a lot of you on here, if you want to share, but I wanted to put this up here. Lori, if you want to say anything, this is the program Kenna referred to earlier in the Look Alive presentation.
I don't have great reception where I'm at, but yeah, this is open for everybody. It's free of charge. No age restriction, no residency or licensing restrictions. So if you just spread the word. And right now we're up to 50 registered plus a handful of people to attend with them. And we're getting ready to put more flyers out in the schools starting next week. Just to wanted to give them like a week or two to get settled in so they just don't rip stuff off and throw it away. So that's what's the current stage we're at right now. Excuse me.
Oh, and I'll share this around to all of you in a follow-up email tomorrow. So if you want to share it amongst your folks, even in the other counties or cities, feel free. I see there's also some folks on here from DPW&T. I don't know if you guys want to add anything about anything going on in Baltimore County. You don't have to, just checking. Okay, great. I do see also some folks from Hartford County. I see Amy's on and Elizabeth from Aberdeen. Is there anything you guys, like I said, you don't have to, just wanted to toss it out there and open up the floor if you want to share anything.
No comments at this time from the city of Aberdeen, but thank you.
Okay, sure. All right. Well, then if there's no others, although wait a minute, let me check. There is something in the chat. It's kind of shared stuff from the two campaigns. Oh, and Amy said nothing at the moment from Hartford County. Gotcha. Thank you guys. And again, thank you all for sticking around. Our next meeting is in 3 months. It'll be December 10th. Again, it's a Wednesday. It's at 1 to 2:30, just like today. I hope we don't keep you 10 minutes late, and I will be much better about the meeting announcements so there's no discrepancies. But with that, I will thank you for all of your time and hope you have a good rest of your day. And I appreciate all your efforts. So please go out there and be safe. Thank you, everyone. Never in the place.